Hi, I'm Lisa Maynard. I'm an implementation specialist for the Center for Adoption Support and Education for the National Adoption Competency Mental Health Training Initiative. I'm also a therapist in private practice in upstate New York. I am also certified as a yoga teacher and a meditation teacher as well. For my work with NTI, as an implementation specialist, I am working to implement and integrate the National Adoption Competency Mental Health Training Initiative in states, tribes, and territories across the country. So I work to facilitate meetings and engage key leaders as well as potential users in taking the NTI and completing the NTI training to increase adoption competency for child welfare and mental health professionals across the country. In my private practice, I work primarily with women who are experiencing trauma, have experienced trauma in their lives, whether it's early childhood sexual assault, domestic violence, or rape, and other kinds of traumas that they may have experienced in their lifetime. I work a lot with helping women transition from, getting married to having babies, to getting divorced, to sending kids off to college. So all those normal life transitions that can sometimes add a little or a lot of stress in a person's life. I love my implementation specialist job. I'm working at a macro level to affect system change for adoption competency to help really support children and families so there's permanency, so that children are not moving around from place to place in the foster care system. So they settle, get roots, and have a family that could be their safety and supports and love them forever. What I find most challenging, I would say for my implementation specialist work, when I was traveling pre-pandemic, about 20 days out of the month, although I love the travel and I love working at the macro level, being away from home 20 days a month was a bit fatiguing and more so than I expected. For my work with women who have experienced trauma, that can get heavy sometimes, especially on a day when I've got 4 or 5 clients back to back who have experienced early childhood sexual abuse or rape, multiple rape in some cases. It gets heavy. It gets hard to hold. And it's an honor to work with those women, to sort of walk with them through that journey to healing. UB prepared me, I think, in really helping to sharpen my critical thinking skills. It was a rigorous program that really taught me to stretch and grow and learn more. There was a lot of collaboration in that. I worked on a number of projects with my peers, sort of negotiating some relationships, for those who are more organized than others, and make more contribution, and really trying to negotiate those teams so that we all made an equitable contribution and came out with a real quality product. Learning more about social justice issues than I had previously sort of explored was really useful as well. My advice to anybody who's looking at the social work program at UB would be to take a hard look. It's a rigorous program again, but really, really, really well worth the time and the effort that you put into it. Do your work. I really, really recommend that you do your own counseling in order to be in this social work field. It's really important to identify triggers. Identify the things that have been sort of under the surface for you for a long time, perhaps, and could get you, could kind of bring you down when you're working with different client populations. And then finally, self-care. Absolutely, positively need to take care of yourself. And we had a number of professors that stressed that through the program, and the field professors as well, was really, really wise. So important. Breathe, exercise, eat healthy, get plenty of sleep, try meditation and yoga. They're totally terrific for self-care. And then have confidence that you can do this. You can bring your best self to your clients and to the populations that you serve.